What if I told you there is a small, specific area on your body, one that most men have never once paid attention to, that when massaged correctly with one natural oil can directly improve pelvic blood flow, wake up dormant nerve pathways, and restore the kind of firmness you thought was simply gone? No prescriptions, no clinic visits, no complicated equipment, just your own hands, a natural oil that costs a few dollars, and 5 minutes of your time. I know exactly what you are thinking. That sounds too simple to be real, and I understand that completely. We have all been conditioned to believe that serious problems require complicated, expensive solutions. But here is what 12 years of urology has taught me. The most powerful interventions are often the most overlooked ones. What I am about to walk you through is not a wellness trend or a folk remedy. It is a technique grounded in the anatomy and physiology of the male pelvic system, one that directly targets the 3 biological systems responsible for firm, reliable erections. Stay with me through this entire video because the last mistake on this list is the one silently doing the most damage to men over 50, and it has nothing to do with testosterone. Here is a question I want you to answer honestly, just to yourself right now. When was the last time a doctor sat down with you and actually explained what is happening inside your body? Not a prescription, not a referral, a real explanation, the kind that makes you leave the appointment understanding your own physiology better than when you walked in. For most men, the answer is rarely or never. My name is James. I am a board-certified urologist with 12 years of clinical experience. And urology is not a general practice. It is a specialty that deals directly with the vascular, neurological, and muscular systems that govern male physical function. I know these systems from the inside. Literally, I have worked on them in operating rooms. I understand how they fail, why they fail, and what can be done about it. The gap between what men are told and what men actually need to know, that gap is the reason this channel exists. After 50, the conversation most men have with their doctor about performance lasts approximately 4 minutes and ends with either a prescription or a shrug. Neither is good enough. Neither gives a man what he actually needs. Understanding, the kind that puts him back in control of his own body. That is what I am giving you today. If you are a man over 50 who has felt that 4-minute conversation was not enough, hit that like button right now. Drop a comment and tell me where in the world you are watching from. I read every single one. And for the men who are new here, I want to be straightforward. I do not post content for the sake of posting. Every single video on this channel exists because there is something specific that men over 50 deserve to know and are not being told. If that sounds like something worth showing up for every week, hit subscribe. You will not regret it. Now let us get into the science, because once you understand what is actually happening inside your body, everything that follows will not feel like a guess. It will feel like exactly what it is, a direct targeted solution to a specific correctable problem. Here is the question I hear constantly in my clinic. How can rubbing oil on the body possibly affect erections? Fair question. And the answer starts with understanding something most men were never taught. An erection is not simply about desire. It is the result of 3 systems working in precise coordination, circulation, nerve signaling, and muscular support. When even one of those systems becomes sluggish, the entire response weakens with it. There is a small specific area of the body that sits at the intersection of all 3 systems simultaneously. An area that when stimulated correctly directly influences blood flow, nerve activity, and muscular tone in the pelvic region all at once. Most men have never once given this area a second thought. And that neglect compounded over years is one of the most consistent contributors to the gradual decline in firmness that men over 50 experience. That area is called the perineum, and that is where today's technique begins. Mistake number 5. Ignoring the perineum entirely. The perineum is the soft area of tissue located between the base of the scrotum and the tailbone. Most men have never consciously thought about it. Most have certainly never deliberately stimulated it. But beneath that small patch of skin lies something remarkable. Biologically, the perineum is the surface access point for the pelvic floor muscles, the same muscles responsible for the contractions of erection and the vascular pressure that maintains firmness. It sits directly over the primary blood vessels supplying erectile tissue and the nerve branches carrying arousal signals from brain to body. It is the control panel, and most men have never once touched it with intention. Emotionally, the experience of desire being present while the body fails to respond is one of the most quietly devastating things a man can go through. It erodes confidence, creates distance in relationships, and produces an unspoken sense of loss that most men carry entirely alone. Practically, a targeted massage of the perineum with castor oil activates all three systems simultaneously, stimulating local blood vessels, engaging nerve endings that have gone quiet, and awakening the muscular tissue that supports the entire erectile response. This is not complicated. It is anatomy. Mistake number 4, underestimating pelvic inflammation. This one surprises almost every patient I mention it to. Chronic low-grade inflammation in the pelvic region is one of the most invisible contributors to declining erectile function in men over 50. You cannot feel it the way you feel a sore muscle, but it is there quietly constricting blood vessels, stiffening tissue, and reducing the responsiveness of the entire pelvic system. What causes it? Years of prolonged sitting, chronic stress, prostate changes common with age, poor dietary habits accumulated over decades. Biologically, castor oil contains a compound called ricleic acid, a naturally occurring fatty acid with documented anti-inflammatory properties that penetrates deeply into soft tissue. When massaged into the perineum, it absorbs into the underlying tissue and begins reducing the inflammatory activity that has been quietly strangling blood flow. Emotionally, inflammation is invisible, which means most men blame themselves for a problem that has a physical correctable cause. Understanding that changes everything. Practically, each massage session is an active, targeted intervention against inflammation that has been building for years. Consistency is what makes it transformative. Mistake number 3, treating circulation like it is fixed. Most men think of their circulation as something that simply is what it is. Either it works or it does not, and because they think of it as fixed, they never do anything to actively train it. But circulation is not fixed, it is trainable. Biologically, the small blood vessels that supply erectile tissue respond to repeated targeted stimulation by becoming more responsive over time. Think of a garden hose king-kecked and left unused for months. The first time water runs through it, the flow is weak. But with repeated use, the walls loosen, the pathway opens, and the flow becomes strong and reliable again. That is exactly what targeted perineal massage does for pelvic circulation. It is not a one-time fix, it is a training protocol. Emotionally, this distinction matters deeply. It shifts a man from a passive position waiting for something to work to an active one. You are not hoping, you are training. And that sense of agency is itself therapeutic. Practically 5 to 7 minutes 3 to 4 times per week is sufficient to begin retraining pelvic circulation meaningfully. That is less time than most men spend scrolling their phone before bed. Mistake number 2, ignoring the lifestyle that supports the technique. I have seen men commit to this massage and still see limited results. And almost every time the reason is what they are doing or not doing outside of those 5 minutes. No technique, however well executed, can overcome a consistently hostile biological environment. Biologically, dehydration thickens the blood and slows circulation. Tight hip flexors from prolonged sitting compress the very blood vessels and nerve pathways the massage is trying to open. Poor sleep suppresses testosterone and elevates cortisol, directly impairing the hormonal environment that supports erectile function. Emotionally, men blame the technique when the real issue is the context surrounding it. They feel like nothing works, when in reality, the technique is working against a backdrop actively working against it. Practically drink adequate water daily. Do 5 minutes of gentle hip flexor stretches. Walk 20 to 30 minutes every day. Prioritize 7 to 8 hours of sleep. The massage is the targeted intervention. These habits are the environment that allows it to work. Mistake number 1, accepting decline as inevitable. And here it is, the mistake that does more damage than all the others combined, not because of what it does to the body, but because of what it does to the mind. The belief that decline after 50 is simply how it is, that the body has had its time, that what is lost is lost. Biologically, this belief is incorrect. Aging reduces the efficiency of circulatory and nervous system function, but it does not eliminate it. The pathways are still there, the blood vessels still respond to stimulation, the nerve endings still fire when properly engaged. What aging does is raise the threshold. What deliberate targeted intervention does is meet that threshold and push through it. Emotionally, accepting decline is not just a physical surrender. It is a withdrawal from intimacy, from confidence, from the full engagement with life that every man deserves to maintain as long as possible. I have seen the weight of that withdrawal in my clinic more times than I can count, and I have also seen what happens when a man decides quietly, firmly, that he is not done yet. The body responds not immediately, not dramatically, but consistently, measurably, and in ways that matter deeply. Practically, starting tonight is not a grand gesture. It is a 5-minute decision, a small bottle of castor oil, a quiet room, and the choice to show up for yourself in a way that most men never do. The step-by-step routine. Here is exactly how to perform the massage. Choose a quiet time after a warm shower when circulation is already elevated and tissue is receptive. Pour 3 to 5 drops of castor oil into your palm and rub your hands together for 15 to 20 seconds to warm it. Cold oil on sensitive tissue creates tension. Warming it first matters. Sit comfortably or lie back with legs slightly apart and hips open. Locate the perineum, the soft tissue between the base of the scrotum and the tailbone. Begin with slow, deliberate circular motions, keeping pressure light for the first 2 minutes. You are warming the tissue and beginning to stimulate surface circulation. After 2 minutes, gradually increase pressure slightly using the pad of your thumb or the heel of your palm. Keep the movement slow and intentional throughout. You are not applying force. You are communicating with the tissue beneath. Continue for 5 to 7 minutes total. Breathe slowly and deliberately throughout. Deep belly breaths that relax the pelvic floor and allow the tissue to fully receive the stimulation. Perform this 3 to 4 times per week, not every day. The tissue benefits from recovery time between sessions, just as muscle does after training. Within 2 to 3 weeks of consistent practice, many men begin noticing changes. Increased warmth in the pelvic region, more reliable morning firmness, a sense of responsiveness that had gradually gone quiet. These are not coincidences. They are the biological result of restored circulation and reawakened nerve activity. Before we close, I want to speak directly to the men watching this and carrying something they have never said out loud. The quiet frustration of a body that is not responding the way it used to. The slow withdrawal from intimacy because it feels safer than trying and being disappointed. The private grief of feeling like a part of yourself has already gone. What you are experiencing is not a character flaw. It is not a reflection of your worth as a man or as a partner. It is physiology. Specifically, the physiology of pathways that have grown quiet, and quiet pathways can be reawakened. Every time you do this massage, you are doing something more significant than circulating blood. You are choosing yourself. You are saying with your actions, not just your words, that you are not willing to accept a diminished version of your own life. I have watched it happen in men who came to me ready to give up. In men carrying this privately for years, in men who, with small, consistent, unglamorous daily effort, came back to themselves in ways that moved them deeply. That is available to you tonight. Your body is not finished with you. It is waiting for you to stop waiting and start doing. The men who reclaim their vitality after 50 are not the ones who found a miracle. They are the ones who showed up consistently with small habits, honest effort, and the quiet refusal to accept less than what their body is still capable of giving. 5 minutes, 3 times a week, castor oil, the perineum, consistency over time. That is the entire prescription, and it starts tonight. If this video gave you something real, hit like. Share it with a man in your life who needs to hear it, and subscribe for more practical, clinically grounded content built for men who refuse to give up on themselves. Drop a comment and tell me where you are watching from. And tell me which of these 5 mistakes surprised you the most. I read every single one. I am Dr. James, board-certified urologist, and after 12 years of watching men reclaim what they thought was gone, I will tell you this with complete conviction. The body remembers vitality. You just have to remember it.